Hi there. Thank you for joining us. We are so excited to have Dr. Stephen Berkowitz with us today, who directs the trauma program in the Department of Psychiatry on the Anschutz Medical Campus. Dr. Berkowitz, thank you for taking time to talk to us today. Before we get into the Q&A, just wanted to maybe go through your background a little bit. Tell us about yourself and the work you do on the campus out there.
Sure. We've been in Colorado now almost 3 years. I was at the University of Pennsylvania before that, where I directed another child and family trauma program that was really focused on in a community mental health approach. A lot of work with the city of Philadelphia, and um, you know that's been my focus, really all my life. And then before that, I was at Yale in the Yale Child Study Center on the faculty, and I was there for about 20 years, where we became the National Center for Children Exposed to Violence, of which I was the deputy director. And our focus there was really on training and first responders, particularly police, in recognizing the impact of violence on children and families, and providing resources and interventions for people who were, exposed to crime and violence in the community. So we did work with a range of first responders, and that's really my career has always been looking and trying to understand the impact of stress, trauma, adversity on on children in particular, but also in the broader context, and really trying to change our approaches and culture around these issues, and recognizing that there are multiple systems that, with the right kind of understanding and recognition, can really improve the lives of people in their communities.
Yeah, that's awesome. So I guess kind of along those lines, the START Center, you're the director there. Just talk about maybe some of the ways you guys help actually people of all ages, I believe, with psychological injuries. Maybe even especially youth.
Absolutely. So the START Center is just Stress, Trauma, Adversity Research and Treatment Center. We provide treatment for traumatized children, families, and adults, with the idea that but trauma is something that's often a developmental issue. People have early life trauma, and then that affects them throughout their lives. Sometimes it's punctuated by another event that really almost puts them over the edge. Um, we provide a range of treatment modalities, from mindfulness to classic cognitive behavioral approaches. We always feel that the intervention has to involve the family, and this is whether you're a child or an adult. That it's so important that the family can support and recognize those issues, and so help that person heal and sustain their health.
Sure.
And then, we do a lot of work with first responders. We actually are the providers for the Boulder PD, so we've been very busy with that. And the reason for that, primarily, not only are first responders, often really suffering from traumatic exposures and stress, but also if they're not healthy, if they're not doing well, they really can't serve effectively. And so we work broadly with, caregivers, whether they're teachers, healthcare providers, police, fire, because we know that we rely on them to support the healing of the children and their families. And so that's really one of the major issues. It's really culture change in
Sure.
a way,
Sure.
for those agencies.
And I imagine, like you kind of hinted at, it's been probably pretty challenging over the last few months with the Boulder PD specifically. But you don't have to get into specific details, but what are some things that you have seen, or some things that you guys have worked on, if you can speak to that with that group?
Um, so, you know, the two things that always stand out as being the most protective factors for people who are exposed to, a horrific event like that
Mhm.
is connectedness and feeling effective. Self-efficacy and effectiveness are, just key factors. And so all our work with the PD was really focused on those two issues. We have a model that we use to explain sort of the impact of events, the natural outcome, and really helping facilitate important conversations among peers
Right.
where that support comes. And when you get that support, then it allows you to go on and have some agency and feel effective. And so that was really the work primarily. We saw a lot of people individually for brief sessions and things like that.
Yeah.
But and then we did some work supporting mental health partners, which are the crisis response part people in that region.
Okay. Okay. Kind of along those lines, we recently had a chance to talk to Brian Greasy, who experienced trauma at a young age. One of the things I thought was really interesting is he mentioned that after his mom had passed, he was only 12 years old. He had a lot of anger, and it was anger at society because they weren't able to cure cancer. And it was anger at himself for not being a better son, and that he couldn't go back and change any of that. And so I'm wondering, when you see, and this could probably happen, even with adults, but how common is that kind of a reaction to someone who has experienced trauma? And what are some ways that you guys, in the work that you do, how do you guys help people who are experiencing that anger? How do you guys get them, or at least teach them maybe some coping strategies? What would you say to somebody if they are experiencing that emotion after experiencing a trauma?
Um, so I think it's important to distinguish, different types of traumatic experiences. And, loss of a loved one, has a different kind of set of typical responses and ways of managing that loss and that death. And what, Brian talked about is just toxic. As a matter of fact, I don't think there's anybody who doesn't have feelings of anger and anger turned inward, which we call guilt, frankly, that, for a brief period of time or a long period of time. It's true of children, adults, adolescents, you name it. That is just typical. And his circumstances were complex, right? First, he's a greasy.
Right.
I'm old enough to have seen his father play. His father was, as he mentioned, really not available. He was, on the road and playing football, and football is all consuming. Um, I do remember actually when his mother died. I remember there being an article about Don Shula supporting Brian. Not supporting Brian, supporting his father.
Okay.
Which is fascinating, right?
Yeah.
So we don't know who was there for Brian, right? And I think that's a big issue. We know there's really really strong data that says that the death of a parent before the age of 12, Brian was 12, is the most robust predictor of depression in adolescence and young adulthood
Wow.
than um, any other, loss.
Yeah.
Um, and so some very smart people in England said, well, why is that? That doesn't quite make sense, right? And it ended up being that it was really incumbent on the caregiver of that child. And if that caregiver was doing okay and managing, then there was no increased risk of a depression.
Right.
It was the problem is very few caregivers really do well.
Sure.
So, what Brian I think described is absolutely common, and that also what he described later in life probably was some depression.
Yeah.
He mentioned with being withdrawn, struggling, so on and so forth. And I think that's probably what he dealt with,
Yeah.
in that very classic, well researched area.
Yeah.
Um, and then you asked about how do you help people with their anger. So I think one of the problems is grieving and mourning is a natural process, right?
Sure.
But if you don't go through it and you don't, the phases, classic stages of grief and healing, it gets interrupted, and you're left with anger, depression, so on and so forth.
Right.
And our job, and what Judy's house does brilliantly,
Hmm.
is not tell them there's something wrong with them, not suggest that they're pathologic because they're struggling, but help them in these often very complex situations. Lots of people who have suicide in the family, or acute traumatic deaths, grieve and mourn the way we're meant to, or hopefully optimally.
Right.
And that's what's crucial. Not getting rid of the feelings, but helping people go through the process in an effective way to heal and grow.
Yeah. Yeah. And you mentioned Judy's house, and similar, I think, to the work that you guys do. That was one thing that also kind of struck me in our conversation with him was he didn't have an outlet to express how he was feeling. He internalized a lot of his feelings.
Exactly.
And so I'm wondering, I guess, how common is that? My guess is you mentioned a caregiver. A caregiver is probably a crucial part of being able to express those emotions. That caregiver could probably be the outlet that they would then have. But you know, how important is it for children, especially, to have an outlet like that? And then who is best, who's best served to be that outlet? And then how would an adult, in just kind of in general, if you're not, maybe you're not necessarily labeled as a caregiver, but you're an adult who is around a child who has experienced trauma, how could an adult help a child who is maybe going through some of those emotions?
Well, traditionally, right, when there was a loss, the family came together, and support each other, and adults and were available to the kids,
Mhm.
right? And it may not be the parent, because the parent may be in the midst of suffering, but some family member,
Right.
right, would be available. Our world's different, right? You know, uh, you know, people live all over the country, all over the world.
Right.
They're not available in the same way necessarily. Um, and so, if when a family isn't, available and recognized, and there's nothing wrong with not being available, it's not surprising, right?
Right. Right.
Um, Everybody needs some help to recognize what they're struggling with, how to support one another, and frankly, in a very different context than we're used to.
Right.
And that's, and so while there's no question, family is the best to support children in this process, the family may need help to do that.
Sure.
And so that's where places like Judy's house or our work come in. We're not there to, treat anything in that regard. We're there to facilitate and support.
Right.
And so the focus should be on, healing the family and healing the children, without, without, too much, I don't know what the word is exactly, expert approaches. It's really
Sure.
about helping people mourn
Okay.
effectively. And that's where, we need to help families. The world is quite different. And that, all those traditional methods may be available, but they often aren't.
Right. Well, and then in line with that, we have probably about 1,500 volunteer coaches that we work with every year. And a lot of times, a coach can be that trusted adult for some of these
Absolutely.
kids. That can be their outlet. So, for a coach who is signing up, coaching his kid, but then has another player on the team, or, somehow somebody that he's associated with this team has experienced trauma, but he has no experience, no background. He's not an expert in the field. Are there ways that somebody like a volunteer coach could be that caregiver, or at least provide that support like you were mentioning?
Well, I think, absolutely. Coaches and teachers can play that role very, very well. They're important people in kids' lives. Um, and one of the things back in my day, coaches were coaches. It was all about the game. There's
And
nothing.
that's what Brian mentioned too, is that
Right,
his coaches, they didn't ask him how he was feeling.
right,
It was play, to go to this play, do this, run this.
right.
So similar to what you just said.
I think that's changed some, right? I think now we recognize that coaches really do have a mentorship role, particularly for, younger kids.
Mhm.
And so you don't have to be, an expert in grief or loss, but you can be a human being. You can be supportive. You can recognize that a child is struggling or having difficulties, and you can be there for them.
Yeah.
And you can share, your experiences, because most coaches probably have had a loss in their life, right?
Right.
And just being a human being, and recognizing that this is a issue for your student or mentee,
Right.
goes a long, long way.
Right.
And you know one of the things that often we'll see about hear from kids in these situations is how they're angry because their mother, father, whomever really isn't supportive,
Mm.
right?
Right.
um, and usually that's because they're struggling themselves.
Yeah.
Well, so an adult can also help kids understand that, right? They're
Right.
in the same boat you are, right? And they need support too. Now that's not your job, but that's something that might be helpful for you to understand. It's not about you. It's
Right.
about what they're dealing with.
Right. Right. So, we've talked about grief and loss as some traumas that youth can face, really anybody of any age can face, but specifically for youth, for us with our coaches and, the kids that we serve, um, talk about other forms of trauma that you guys see, and then what strategies do you guys teach these young patients, or how do you work with these young people who've experienced different kinds of traumas beyond just loss and grief?
Well, unfortunately, the most common, uh, you know, overarching traumatic situations that kids are in is maltreatment.
Mm.
Um, and I actually think, and I think there are others that think that child abuse and maltreatment is probably our number one public health issue. I mean, obviously, COVID overtook that, but that's I
Right.
over time.
Right.
And maltreatment can take in, a range of different forms and types.
Right.
And so we see a lot of children that have been sexually abused, physically abused, emotionally abused, severely neglected. The range of things that you think can happen in the home.
Yeah.
All those things that you've read about, heard about, that's what we see.
Right.
And unfortunately, that's all too common. And that kind of exposure, which is this cumulative, you know, varied, you know, insults, really can be severely problematic. And one of the major reasons it's so problematic is not only, the cumulative and constant approach in a family, for God's sakes, it's also that we're talking about a very critical time in children's development, and particularly brain development. And so, one of the things that we know, and there's much research, shows that we really injure the brain when we, maltreat kids.
Yeah.
Um, and our job as treaters in those situations is to try our best to help these kids really be able to regulate and recognize what's going on internally,
Mhm.
because often it's so fragmented, it's so hard for them, and they may not have words for it.
Right.
And so a lot of our work actually is physiologically based. Things like, you know, effective breathing that releases and reduces stress. Um, uh, you know, processing and trying to think through other problems in order to figure out how to deal with this set of issues.
Hmm.
Um, and also importantly, I mentioned that we always work with the family. Well, some of these kids won't have families. And so who do you work with?
Right.
And how do you help? Just like we were talking about that family member, teacher, coach, who do you
Right.
work with
Right.
to, help that particular child? It could be a foster parent as well. But that's crucial work because these are kids who, for all the most understandable reasons, are very difficult to
Right.
manage. And then, of course, we see, the more classic, motor vehicle crashes, exposure to violence of some sort. So really the range traumatic situations. I think what's important is that depending on the symptoms and the type of exposure, the modality of treatment is, going to be adapted to that particular child and family.
Right. Right. So going back to coaches and teachers, with the maltreatment, or even, if they have a player who has experienced violence, you know, how again, somebody who's a coach, a volunteer coach, doesn't have any training or background. I guess maybe one question is, do you think it's important that we have some sort of training even for like a volunteer coach? Or is there something that we
Yes.
could arm our coaches, our youth coaches, with some sort of tool that could help them handle these types of situations?
Yeah, absolutely. And, we have done some what we call trauma informed training for mentors and teachers. And while I haven't done it for coaches, I know that there are some that do.
Hmm.
And I think that would be very helpful. Not to, try to get you to be a therapist. That's not
Sure.
the goal. It's more about recognition, kind
Sure.
of knowing, how do you recognize kids and what may be behind their struggles,
Right.
how to gently talk about it, and
Right.
then how to support them getting into effective treatment,
Right.
right? Um, so, you know, what I've heard over the years from coaches, there's always those three kids that, don't listen or, fly off the handle really too easily, and so on
Right.
and so forth. Odds are that they have histories of trauma,
Right.
right?
Yeah.
Um, and recognizing that can be so empowering and so
Mhm.
helpful to a kid.
Yeah.
Your coach recognizes that and they
Yeah.
care.
Yeah. And I think that's a very important point is, the recognition is one piece of it, but then, I think arming our coaches with that next step of what do you do then at that point? Like, I think that's also very critical. And something that's probably, at least I think in our leagues in the past, hasn't been widely known. And that's something that we're certainly working on. But that's one thing I think with coaches potentially being this trusted adult, arming them with the tools to be able to recognize some of these other traumas, I think is important because they do spend a lot of time with these kids.
Right.
And I think these kids, if they do trust them, they're going to be more inclined to open up to them and maybe get into some of those past traumas where instead of just being the difficult player that doesn't listen, the coach could find that there is something that's causing that, which I think is
Ab-
important.
Absolutely. And I want to mention that I think sports are absolutely a great aspect of treatment.
Yep.
I mean, you know, again, going back to the idea of being connected and
Mhm.
feeling effective. Well,
Yep.
that's a great thing about sports,
Yep.
right?
Yep.
Um, and there's plenty of research that shows that involvement in sports is very protective.
Yeah.
So can we take it to that next level, which was what you're talking about? And
Right.
I don't think, I almost think that we don't have a choice, to be
Right.
honest.
Right. Yeah, I would agree. And that actually kind of perfectly brings me to the last question I have for you today is talking about kind of with COVID and the connectedness of playing sports. Our organization worked really hard to keep our gym open as much as we
Yeah.
could, keep kids playing because we knew that that was an outlet for them. We knew that it was important for them to have some sort of normalcy with their extracurricular activities. So a couple questions here. I know everyone is so sick of talking about COVID. Hopefully we're almost done talking about it, but as you look maybe into the future, I know you probably don't know a ton about what we're going to see in the next several years, but are you considering COVID as maybe a trauma that these kids have gone through? And what do you think the lasting impact, if any, is going to be on our youth? And how can we, as just a volunteer coach or somebody in the community, how can we help kids kind of get through maybe what they've experienced over the last year and a half?
So I think, and I want to back up a little bit from COVID for a second,
Okay.
because obviously that it was this universal, extreme, chronic, drop, drip, drip, drip stress, right?
Right.
But we also have all these other stressors I think that kids are facing that are you can't exactly separate out.
Right.
So kids are well aware, for instance, of climate change, and that's a major stressor for many many kids
Mhm.
because the future is uncertain for them,
Right.
right?
Their future. Yeah.
That's right.
Yeah.
That's right. Then we have a very complex society, which technology has both helped and harmed. And then we have this kind of more than ever need to make sure that you're successful and achieving, academically and so on and so forth.
Right.
Um, and one of the, to me, one of the, great paradoxes is on one hand, we have very, successful families and kids stressed out of their mind and making suicide attempts at a high rate.
Right.
Then we have another part of society that's just struggling to survive
Right.
and committing suicide at high rates,
Right.
right?
Right.
So I think it's just important to recognize that I don't think I think it's more than COVID. I think COVID was almost the you know the cherry on top in terms of
Right.
let's just add to these
Something
inordinate
else.
stressors, right,
Right.
that we're already seeing. And I think
Right.
that's one of the reasons we're seeing kids struggle so much
Hmm.
with this is not just COVID, but it's like, oh no, this again, more.
Right.
How does this fit into all of this?
Right.
And I do think there are going to be long-term impacts. Uh, Now, they may not all be bad, and I think that's important to recognize. There may be
Sure.
growth and development that comes out of that.
Yeah.
But I think the transition back to, I keep thinking that we're reemerging like the cicadas on the East Coast, it's all like, boom, we're back. Uh,
Right.
well, that's just not it's not back to normal.
Right.
Um, you know, One of the great stressors for a lot of kids is going to be just their education and
Hmm.
where they're at, and that, schools having to adapt to kids who are a year behind, 18 months behind, right on schedule. What a stressor that's going to be for all
Right.
of them. And that's going to take a number of years to
Right.
sort out.
Yeah.
I think the other thing is, I think, relationships are going to be different. And I've already been worried because of, technology and whatnot. A lot of kids don't really know how to talk to one another.
Yeah.
Uh, and I think this is going to exacerbate that. And then when you think about young kids, there are 3 and 4 year olds out there who never saw another adult besides their family,
Right.
right?
Right.
Besides their immediate family and their siblings.
Right.
Wow. What is that going to be like
Yeah.
when they're going back to preschool and dealing with others,
Right.
or even seeing their grandparents? You know,
Right.
so there's a lot of unknowns. I can't predict, and
Right.
nor will I. But I think there's going to be some struggles. And I think you probably saw the Children's Hospital, mental health emergency.
Yes.
Right now, suicide is the leading cause of death for kids. Suicide.
Yeah.
And I think it's really that struggle with, I don't know what's coming next. Is it worth it?
Right.
Uh, and the world is not something I'm really happy with.
Sure. So for yeah, if you have youth that have those thoughts that are thinking, I don't know what the future holds, and I don't really know if I want to know what the future holds. For somebody who, again, is not experienced in dealing with this type of stress, do you have some simple ways that, or just some ways that a parent or a coach or a teacher could work with these kids to make sure that they don't have those thoughts, or that they can communicate those thoughts so we can get them some help if that truly is how they feel.
I
Uh,
think there are two important pieces of action, and I think Brian mentioned them. One is availability,
yeah.
just letting people know you're there for them,
Yeah.
that they're not alone. I mean, one of the
Asking
things,
how they're really doing.
right,
Like that, I think that
exactly.
was so important. It's like we ask people all the time, "Oh, how are you doing today?" "Good, thanks." "How are you?" "Great, thanks." "Okay." No, how are you really doing? How do you really feel today? That
Absolutely.
I loved that point.
And I think even to put a little finer point on it, if there's a kid, you'll see irritability or mood issues and all that, connect it. You say, I've noticed, Johnny, that, you kind of seem a little more stressed out and a little irritable. How are you really doing? Right?
Yeah.
Just
Yeah.
so I think that in and of itself is powerful. And it
Yeah.
sets the stage for the child and the youth to say, I can tell this guy, this gal, what's
Right.
going on with me, right?
Right. Right.
So I think that may be more important than anything else.
Yeah.
The other piece that I think is important is to model,
Mm.
right? You know, all too often adults have this feeling that they have to act like they're perfect,
Hmm.
right?
Right.
They're not perfect. They're human.
Right.
Let yourself be human with these people.
Yeah.
with your students, with your players, right?
Yep.
Allow yourself to demonstrate that you have vulnerabilities, you have struggles. Um, it permits them to be able to say, "Oh, I do too."
Yep. I completely agree. I think those are great tips for the coaches that we deal with. I mean, even just parents in general. I mean, we have 15,000 participants that participate in a program that we run throughout the year. I mean, so having, that's how many parents are impacted
Right.
too. So
That's
yeah,
right.
so that's awesome. Well, thank you so much for taking time to talk to us this morning. Really appreciate it. We'll put the Start Center information up on our website, make sure that people know that that's a resource. We do have other Anschutz Medical Campus resources up there, but really enjoyed the conversation and want to thank you for taking the time to talk to us this morning.
Well, thank you. This is really important, and and you know, sports is such a great vehicle, and the work that you're all doing is phenomenal. And
Thank you.
let's make it better.
Yes, I know. We've got a lot of sports coming up this summer. We're really excited that we're getting back. The gym's going to be full as we can make it, and we've got kids playing sports, which I think, like we've talked about, is a great outlet for them. So we're going to keep going with that.
Okay.
Okay, great. Well, thank you so much again. Really appreciate the time.
Yes, me too. Take care.
Uh-huh.